One shot a week and pounds melting away. Let's talk about what's really going on inside your body when you take a GLP-1 medication. That's what I have questions about. David, I'd like to start out with what is a GLP-1 and what's it used for?
Okay, so a GLP-1 stands for glucagon-like peptide dash 1. It's actually a peptide, acts hormonally, something that's naturally produced by your body. And it's produced mostly in your gut, but also your brain produces it. These drugs are drugs that mimic the effect of that. So, what is their purpose? When you eat, your body releases it and it plays a major role in blood sugar control, digestion, and appetite regulation and satiety. Satiety just means the feeling of feeling content and full and having enough food. So these GLP-1 medications act like or mimic this natural GLP-1 hormone, but in the drug form, like you're talking about, even injections, and now there's various pill forms that are coming on the market as well. They act at a much higher level and longer lasting time frame, which is why they have such powerful effects. So they originally used to treat diabetes, the first generation ones like Ozempic, but they found that they had this weight loss effect. And now I would say that these are pivoting to medications which are mostly used to treat that, to help people lose weight. And that's why you see they're so prominent today.
What side effects do people commonly experience? What are the risks?
That's going to be a very critical question because they do have a lot of side effects.
Uh-huh.
They have things such as causing indigestion, nausea, and some people, because just that alone, they can't tolerate it. But they also have other side effects such as decrease in your lean body mass.
Like
They
your
have,
muscle mass, is that what you mean?
yes, just not only muscle mass. So when people, this is an important concept. When people talk about muscle or lean body mass, what are they talking about?
Uh-huh.
What figures promptly, obviously, is muscle mass. When you see someone on their body, so what's something that's not fat, non-fatty, mass is muscles, but it's also things like your bones, your heart, your liver, your tendons, and your
Oh.
ligaments. The things that hold you together is lean body mass. And so when that goes down, you want to try to make sure you do the proper things to maintain that. Obviously, we mentioned that muscles are the forefront what people think about in terms of lean body mass. So you want to probably integrate something that involves resistance training so your body still has a signal to keep that muscle.
Uh-huh.
But on the other side of that, not only is it important to give your body the stimulus or the signal to keep the muscle, you need to provide it adequate nutrition to maintain that lean body mass. So the way this really works, GLP-1 drugs, is going to decrease your appetite. It sort of causes like, traffic jam or slows things down. So you feel fuller, you have better blood sugar control. But in that, if you eat less food, the food you eat becomes even more critical in terms of its quality. So I want the audience to think about it. Well, I'm not going to eat as much. Well, if you're not going to eat as much, if you're going to, what you do eat matters even more, that it's got to maintain or be able to provide for you what your body needs in terms of building blocks for energy, building blocks for structural tissues that are important. Like you said, lean body mass, that includes your heart, your liver, your bones, your tendons, your ligaments, your muscles. We need to eat to sustain and support those tissues, because studies have found that a significant portion, maybe around a quarter or around that number, of the weight that you lose is not fat. So it comes from those critical tissues we're talking about, was where the weight loss occurs. So that's something to think about if this is something that is going to be considered as an option to help in a weight loss journey.
Okay. And you said that it slows your stomach emptying, right?
It does.
Or
It does
kind of
slow me.
so
Yeah.
so can that cause GI problems as far as obstruction or
Yeah. I mean,
anything like that?
yes, it can cause, for some people, diarrhea. It can cause constipation,
Okay.
reflux. So there's a whole host of GI or gastrointestinal symptoms that these things can cause. And a significant number of people, like I said, can't continue them because of the side effects, or they don't think it's worth the side effects to continue on.
thinking about that, as anesthesia providers, we worry a lot about stuff in your stomach. So if somebody's going to have surgery, are they affected by this? Do they need to worry about it?
Absolutely. So as anesthesia providers, our biggest concern isn't just, obviously the weight that you have. We have, depending on like certain areas, they might have weight cutoffs, but it's also what's left in your stomach when you go under anesthesia. And that's one of the biggest things that we focus on, because even if you haven't eaten in hours, these drugs can cause, for lack of a better description, a traffic jam of food in your digestive tract. So it can back up. And if there's food still remaining in your stomach and you're under anesthesia and the food comes up, that could cause a life-threatening situation if it goes into your lungs. It's something that is one of the top priorities we have. So if you are on one of these medications, be sure to talk to your healthcare provider, especially your surgery or GI or anesthesia healthcare provider, so they can give you the proper instructions on what to do or not to do when you're on these drugs to keep you safe when you're getting procedure and anesthesia for that procedure.
Okay. These are long-acting drugs, or some of them are anyway. How long do they last, and
Well,
what
good
should
question.
you do? I guess what you should do before surgery is just talk to the provider.
Absolutely, because whatever guidelines are out there, they're probably changing. New drugs are coming on the market. And for instance, you mentioned a single once a week shot. Well, generally that tells you that lasts around that time frame. These newer oral or pill versions, they last about a day because you take them every day. So that gives you an idea how long they last and what mechanism there is. And I want to tell the audience, this is just the first round, if not to get too technical, but when antidepressants in the selective serotonin reuptake inhibitor, or SSRI classification, coming out, one of the first ones was Prozac, and then new ones came out that affected more than just serotonin. And in that same way, the first generation ones were shots you took in long intervals. And the newer ones, there's oral ones. And now I believe Eli Lilly has one that works on not only the GLP-1 receptor, but on what's called the GIP receptor. So that's a new one. I don't think it's out yet, or it's close. It's pending approval and trials and all that, but that will be a drug that works on the second receptor. There are drugs in the pipeline that work on 3 receptors. So we don't know exactly how that's going to affect for us as anesthesia providers, but I mean, some of the numbers that I saw, these are just rough numbers, but these 3 receptor drugs cause an average of over 70 pounds of weight loss in about 68 weeks. And you think about that.
8 weeks?
68 weeks. So it's over a year.
Oh,
but
68.
Yeah, 68 weeks. So I know they did it in weeks, the trial, but that was over 70 pounds. And that's like bariatric surgery level of weight loss. That's I don't think any of the other ones had that overall result of that much weight loss. So those are coming down the pipeline. So again, this is just the Ozempic or Zepbound, Mounjaro. I think they're the first wave. Okay. And one way these drugs have evolved, again, the oral versions have come out rather recently. Before that, it was all injections once a week. I think that was the most common kind.
Okay. Well, let's recap some of the major takeaways if you decide to take these drugs. You said that the most important thing, or one of the most important things, was that you eat nutritionally dense food, right?
Yes, absolutely. Another thing that's correlated with these drugs is it seems like they increase the incidence of what's called macular degeneration. It's an eye disease that affects your macula, which is a part of the back of your eye that helps you get vision. And they've seen an uptick in patients on these drugs get that. And there's some thought that might be related to glucose regulation, but there's also probably a nutritional component to it. So it's important that you eat nutritionally dense foods.
Okay.
And sometimes you can even see, Eva, you've seen on the ground, people that they lost a lot of weight, but they look hollowed out and they just don't look like their tissues are doing a great job of maintaining their integrity.
Yeah, I do see that. And they start other signs, losing their hair. They just don't look healthy overall.
That's right.
And you mentioned resistance training to try to maintain some of that lean body mass.
Yes, I think that's important because the older you get, the more important your lean body mass is, and your muscles are very important in order for you to be able to move well. And that metabolically active tissue plays a huge role in your overall health, in your mobility, and your ability to ambulate. And those become bigger and bigger factors the older we get.
Makes sense.
Mm.
And then anesthesia, if you're going to have anesthesia, talk to your provider specifically about the fact that you're on one of these medications.
That's right. I think that they need to be in the know about that so they can go over the plan for both when to stop these medications and the type of diet you may need to go on to make sure that your stomach remains empty when you're under anesthesia. And the reason that's important is when you're under anesthesia, you no longer have these what we call protective mechanisms. When you normally throw up, when you have water in your stomach, you're awake, so your body prevents that from going down into your windpipe, into your lungs. Well, when you're under anesthesia, that reflex is gone. Very important point.
Very
If you're going to
important.
get anesthesia or sedation, make sure you let your team, your healthcare team, know that you are taking these medications and they can guide you to decrease risk and provide you a safe anesthetic.
Okay. And then I guess the last thing that sounds like there's lots of new things coming out and lots of new medications coming out, and I guess the jury's probably still out on what the long-term effects are, and just stay informed and, think about it.
Yes,
Be
think about it.
informed before you start one of these medications.
Yeah, it's a big decision because we know also when you stop them, many people, maybe even most people, the weight comes back very quickly.
I wondered
So
about that.
yeah,
Yeah.
I think you kind of consider this to be a long-term medication. It's not like, oh,
Mhm.
let me just get through this bridge and I'll stop it. It just seems like some people have reported that the hunger comes back, roaring back.
Really?
And yes, and I've heard people say that, this helped calm the term food noise, that they're not
Mhm.
constantly thinking about food. But on the other end of that, the brain and what's called anhedonia, inability to feel pleasure. I've actually talked to people that I've known personally tell me, I lost 40 something pounds. I felt physically great. I missed eating and having fun eating with people that I enjoy hanging out with. And they stopped it for
Mhm.
that. That's something to consider because many people report a loss of interest in food. That sounds great. But there's also a broader, what they call this emotional flatness, which might be a good way to describe what anhedonia means. And if you used to get dopamine from eating a croissant or even something healthy like steak, and you lose joy from that, maybe is there also crossover to things like music or hobbies or social connections?
Well, you said it does affect your brain in some ways too,
Yes.
so
Yes.
I guess we don't know
Yes.
that
See,
yet.
exactly. We don't
Mm.
know. So the jury's still out.
Mhm.
These drugs have been around for a couple of decades, but these newer generations of them, we don't know what the long-term health effects will be.
Okay.
Uh, Things like the macular degeneration or the loss in lean body mass are concerning. They can also be these drugs can be life-saving, but I will
Yeah.
say that just tread carefully. Uh, it's a thoughtful something. It's a big deal to make a decision to go on these drugs, or keep in mind that if you look at the history of pharmaceuticals and things which have come in and maybe been game changers, just have some level of, I would say, maybe a healthy skepticism.
Okay.
Again, we have to use drugs effectively and they can do things which are great, but just keep that healthy skepticism and keep an eye out. So again, I want our audience to be educated and thoughtful as they think about whether or not this is something that can help them or their family or their friends.
That's great. I think this has been informative. If you all think that this episode made you think or rethink something, please hit follow, leave a review, and share.
Thanks so much for watching. We hope this episode gave you powerful, practical health tips you can actually use. If you enjoyed this content, give us a thumbs up and hit that subscribe button. It really helps our channel and podcast grow. And don't forget to follow us on YouTube, Instagram, and Facebook so you never miss an episode. When you support us, you're helping more people just like you get access to real, helpful health information. Let's grow together and live a health yeah life.